For head and neck cancer, I like to not just individualize it totally, because it really is a team sport. And any place you go to get treated for head and neck cancer, you really need to make sure that the whole team's strong, not just one aspect. And for us, that relates to medical oncology, radiation oncology, surgery, but also ancillary services like speech language pathology is really important. Radiology, having the right people with doing the right scans and the right techniques. And so, although I have a lot of experience and I really enjoy the patients, I think one of the keys that separates UNC is having that whole gamut of the team needed to treat patients. And we know that leads to better outcomes. My approach to patient care is really to look at the patient as an individual. Although there are a lot of guidelines and there's a lot of standard care that we provide, that standard care doesn't necessarily fit with each patient depending on their other medical problems, their wishes, what they have for their occupation. Things like that can really affect how we approach patients. And every week we have a tumor board. We discuss all of those things for each individual patient and what would be the best approach. Now, obviously, we want to cure the patient's tumor first because that is key. But outside of that, we do a lot of discussions related to functional outcomes, how the patient is going to interact in their environment, because a lot of the things we do affect speech and affect how patients look and affect how they swallow. And so much of our interactions with each other is around meals sometimes. So we really want to not only cure the patient, but we want to have them have a fruitful and fulfilling life. And that quality of life comes more and more into play as we get different treatments that are able to be just as effective on curing the tumor. Then we can start deciding which one's best for individual patients. Why did I become a doctor? Great question, because I do tell some people I think life's sort of a random walk, and your experiences obviously guide what you're going to do. And at first I thought I might just be a scientist, and I don't want to say just be a scientist, but only be a scientist because now I feel that I'm a surgeon scientist. And when I found that you could really combine being able to care for patients with sort of advancing scientific knowledge and advancing care for patients, that's when I really got excited. And that's why I became a physician, is because I really enjoyed both. And I like a wide variety of things. So being able to combine those two loves into one profession was really what drove me to become a physician. I chose UNC Health. One, I've been a lot of places, maybe not 100, but I've been a lot of places. And I also advise for a lot of places where I evaluate otolaryngology programs or cancer programs. And UNC is really unique in a lot of ways. It has strengths in translational research, in basic research, in clinical research, and it has really great teams in different areas of care that we need for patients. Some places can also claim that, but I think one thing that sets UNC apart is the collaborative nature. Here, there really is a group of people who are looking to interact, looking to advance the field, looking to care for patients in the best way. And there's not as much turf wars or turf battles. And that collaborative nature is really something that I think is a UNC culture that's hard to find other places. I don't know if it's interesting or not, but like I said, I really enjoy a lot of different things. And so that's not only in my professional career, but in my non-professional career. So I do a lot of yard landscaping, gardening. Right now I'm putting in a rock wall and elevating the backyard because there's little damp areas out there. I've put in French drains. So I really enjoy that type of things. I also like to bake, mostly in the winter months because I don't like the cold weather as much. But when the winter comes along, I really like to try new things baking wise and see how people react to those. And my wife likes that too, because then she doesn't have to deal with that. Another thing I really like is stacking rocks or making cairns. I don't know, I just like the balance of it and the intricacy and trying to figure out what is the next step for putting together some of these creations. Now they don't last very long. Usually within a couple days they're falling, but I really do enjoy doing that.